Hey friends, it's Leah with the CathCast, part of the Ally program. And today I am joined by the fantastic Dr. Daniel Stein. He leads the Department of Urology at George Washington University as the chair, and he specializes primarily in complex urological conditions. His specific expertise is in urethral stricture, bladder injuries, and neurogenic bladder, specifically for individuals that have spinal cord injury or multiple sclerosis. He has his Master of Health Science from Johns Hopkins, a medical degree with honors at UCLA David Geffen School of Medicine. He did his residency at Northwestern University and his fellowship at Detroit Medical Center. He has received awards for excellence in teaching as well as clinical innovation, and he is committed to global health and serving the community worldwide. Dr. Stein, thank you so much for being here with us today. We are very excited to have you.
Thanks for having me.
Absolutely. So my first question, you've built a career that surrounds urology, trauma, global health. What originally drew you to this very specialized field?
Clinically, what drew me to it, when I started off my career, I started off as you had mentioned, at the School of Public Health, and I did epidemiology, biostats. I did sort of vaccine development applications. So I've always had an interest in global health.
Mm-hmm.
As a clinician, that's a little bit hard, but I've tried where I can to sort of go out and do some global work. Mostly it has to do with surgical teaching globally, try and empower other people. And then in terms of my clinical interests, where I ended up getting involved with trauma and with neurogenic bladder, was the trauma was just sort of an interesting field where everything is unique and specialized. Everything we do is sort of a custom job each time. So that's just sort of interesting. And then neurogenic bladder was actually more out of a need.
Mm-hmm.
Originally, I had no interest in doing it. And then when I got into practice, I realized there just weren't a lot of people doing it. And there was a big need among patient care. So that's how I ended up falling into that.
I like it. What are some of the things that you feel like the public is not necessarily aware of or that they rarely see in regard to neurogenic bladder?
Um, one of the main things when people think about, especially if we're talking about spinal cord injuries or sort of acute neurologic conditions, people often think about mobility. That's sort of the main thing that comes to mind for people, walking, wheelchairs. But bowel and bladder disease or bowel and bladder continence or quality of life is really probably more important to patients down the road
Mm-hmm.
than even mobility might be. And it just gets overlooked and isn't addressed very much. And also a lot of times patients won't bring that up because they're embarrassed by it, or they just think that this is just the reality they have to live with. And so it's just important to bring that up with people and talk to it, and you realize that there's actually a lot of work that
Completely
could be
agree.
done.
As an occupational therapist, with my background in inpatient rehab, so many times I would have to ask a patient, what is your goal for rehab? And in the beginning, they would say, I want to be able to walk again, or I want to get back to normal. But to your point, 6, 9 months, a year down the road, it changes. And they really do just want to have some normalcy in their, bowel and bladder function.
Absolutely. I mean, I think for some patients, it affects their ability to go out,
Yeah.
socialize, maintain relationships. And, at the end of the day, people get used to, I'm not saying it's a good thing, people get used to being in a wheelchair, get used to their mobility. They can find ways around it. If they're living in a diaper or if they're needing someone to change them, that's going to affect their lives
Absolutely.
tremendously.
Everything. For those individuals that aren't necessarily as well versed in neurogenic bladder, spinal cord injury, all of the mobility issues, how do you explain what you do on a daily basis for someone who may not necessarily be in the medical field with that clinical background?
We'll mostly explain to people that, as we said, with any sort of neurologic condition, that the bladder, I mean, I focus mostly on bladder health,
Mm-hmm.
obviously. The bladder is a muscle and it's a group just like anything else. And just like people need to learn how to manage their, paralysis in their legs or anything like that, we need to figure out how to manage their bladder. And there's a lot of management approaches to it. There's a lot of testing that we can do, but we have to figure out what is going on in order to help people and then figure out how to live their lives.
Right. And to that point, you help folks not just regain function of their bladder, but you're giving them a sense of dignity and independence and confidence. Can you speak a little bit more about how you help patients regain that very important facet of their life?
Oh, sure. I mean, when I first see a patient and they come in to see me, first conversation I have with them is I set sort of the goals of what we are there to do,
Mhm.
right? And when we're dealing with neurogenic bladder, I sort of put things in three big categories for patients, right? Number one and two are sort of on me to do, right? And I say that's really keeping their kidneys healthy, right? Because that's one thing that people just don't think about, and that can be a long-term problem. So it's on me to make sure that we're maintaining kidney health, keeping them away from severe infections, urinary tract infections. But most importantly, and what I launched into probably most, is quality of life for patients, right? That's a third big category that we work on. And I break that down to patients to say, look, for the most part, that is continence, so being dry. I mean, I've had patients who break down in tears if I tell them, hey, I could get you dry. And you don't have to live in diapers, right? I mean, that's huge for especially young patients.
Absolutely.
And then independence, right? Just like mobility, people don't want to be pushed around in a wheelchair. They want to be independent. Same thing with their bladder management. They want to be independent, and we work with them on that. And then one of the things that's often overlooked from a quality of life perspective with patients is sexual health, which is something that is just generally under-addressed, which
Agreed.
isn't exactly bladder health, but I'm a urologist, so it falls in
It's
my
a piece
camp
of-
anyway.
Yes, they are connected. They are absolutely intertwined.
And everybody's embarrassed to talk about it, and I'm not, so there you go.
We need to normalize it more,
Yeah, absolutely.
And that's one thing that I've learned as a clinician is the more comfortable and confident we are in delivering that message, then that's going to be exuded, to our patients. And so I think it's a crucial piece of the educational puzzle. Is there anything specific that you wish individuals would be aware of, or anything that they should do before coming to see a urologist?
Well, those are two questions, right? So what should they be aware of and what should they do before coming to see me? Aware of is exactly what I said, is that there are probably other ways to manage their bladder than they have initially, right? The initial management after someone gets diagnosed, probably whatever they had for the first 6 months, is probably not usually the only way out there. There's lots of options. There's lots of things we can do. So that, I think, is just first and foremost that people not to get stuck in their status quo and just say, well, this is how I have to live, and this is what it is. What should they do before they see me? Mostly just bring their records in.
Yeah.
Because trying to piece the information is a little bit hard. But getting in to see someone, I think, is the importance. And I think patients need to advocate for themselves on that, unfortunately, is people need to say, look, this is, if this isn't the way I want to live, sort of go out there and say, ask questions.
Yeah.
What can I do? Is this the only way that I can manage this?
And there's so many other solutions.
Yeah.
Normally, it's not one size fits all. There's not just one solution that's going to work best. It's, a variety.
Absolutely.
What about, it's very important to have a multidisciplinary approach when it comes to treating bladder health, whether it's infection management, we're looking at, functionality, we need the urologist place. In your own words, how would you explain the importance of that multidisciplinary approach in promoting quality of life?
Well, true in a lot of fields of medicine, this among that.
True.
Anything we can do multidisciplinary tends to be better. Unfortunately, realities of healthcare tend to preclude a lot of that.
Right.
What we can usually do is at least have clean lines of communication between providers. And that doesn't only mean healthcare providers, that also might be therapists, that might also be distributors of supplies, that might be home health, that might be any number of different factors. So if we can't get true multidisciplinary, which would be ideal, I agree, if someone could come in and we'd have a whole team of people, that'd be great. But I've tried to build that for years and it's financially awfully difficult.
It is.
But at least lines of communication could be good. And that's where I think I found, at least in my own network, I'll find really good rehab docs who are willing to go the extra mile and give a call and discuss a patient. And that way everyone's on the same page. Or, patients come in with their caregivers or with their friends or with a family member. So at least there's a sort of internal multi-group effort to sort of get care in. But you're right. If we could get true multidisciplinary, that would be ideal.
It'd be so fantastic.
Doesn't work in this system.
It doesn't,
so well.
Unfortunately. We can hope, though. Maybe someday.
I keep trying.
Hey, I'm Dylan from Wheelin' with Dylan.
And I'm Leah with the CathCast. If you're listening to this, you are already part of the conversation, but there's a lot more to explore inside New Motion Medical Supply's Ally program.
And all our podcasts live there too. So if you want to catch past episodes or get the earliest access to new ones, that's where to go.
And the podcast is really just one piece. Inside Ally, there's a full library of articles, webinars, and short videos focused on bladder health, catheter use, and building routines that work for you.
It's also a great place to see how others are navigating things day to day. Real setups, real experiences. and things you might not always hear in a clinical setting.
And a big part of that is the community forum. There are sub-forums for different experiences and stages of life. So whether you're just getting started or have been doing this for years, there's a space for you.
You can ask questions, share what's worked for you, or just read and see how others are handling similar situations. It's a really easy way to connect and not feel like you're figuring everything out all on your own.
And it's simple to access. If you're a NuMotion medical supplies customer, you can log in with your My NuMotion account information and start exploring right away.
It's completely free, and everything's in one place at catheters.numotion.com/ally.
Head to the Ally program today and join the conversation.
We'll see you there.
So we've spoken a little bit about infection prevention and keeping individuals healthy. And I think that is very important. And in much of the research that I've done, that is always a very top priority when it comes to bladder health. But when it comes to individuals with spinal cord injury, and you've touched a little bit on sexual intimacy as well as maintaining, skin health, what are some of the other important facets of bladder health when it comes to individuals who have spinal cord injury?
One big thing that specifically I talk to patients a lot about is that the bladder health and the bowel health are quite closely interrelated. And oftentimes we're struggling on both. So that's just important for people to realize that those two go hand in hand. And obviously sexual health comes into play on both of those. So, I mean, part of it is also just to explain how things work to patients so that they understand. Identifying what an infection truly is. That's a struggle that we have, especially our patients who catheterize or things like that.
Right.
Not all bacteria are bad, right? We're not trying to get everything sterile. We're not trying to scrub away all good bacteria from our skin. So there's a lot of factors that's just educational. It's just explaining to patients, antibiotics aren't always good.
Right.
Usually not, right? And there's a lot of work in other aspects to try to get reduction of sort of infection, at least in that regard.
Yeah, absolutely. We've discussed quality of life. You've mentioned it a few times. As an OT, it's something I'm incredibly passionate about. And you've been published regarding quality of life when it comes to urologic care. So, in your own words, can you elaborate a bit more on what quality of life means to you as well as for the patients that you have the opportunity to serve?
So 2 questions. What it means to me. What it means to me is kind of irrelevant. And that's what I explain to patients. So it's like quality of life is individualized, right? There is no one size fits all. And that's when I explain to patients at the beginning, I say, look, quality of life is what you tell me, right? My goal is to tell you what the options are, right? But it's what their goals are. So, I mean, with regard at least to neurogenic patients, for the most part, it breaks down to a few bigger categories. One is independence, right? And that's different for different people and different levels of spinal cord and different abilities. But it's what kind of independence are they looking for? What kind of independence can they have? But independence is very important. As I'm sure you're well aware with a lot of our neurogenic patients, there's a strong sense of needing to be independent. I understand that. And that's especially people who've lost mobility. Any kind of independence would be really important for them.
Right.
So I think independence is a big deal. Continence is probably one of the biggest deals for quality of life. I mean, just being dry on its own is a huge thing for many of our patients. And so I do talk to them a little about that. There are other factors, too, that come into play. As we talked about sexual health, that kind of comes to play into quality of life, intimacy, socializing, being able to go out for dinner, being able to go out with friends, being comfortable at work. I mean, any number of different factors come up. Now, but that's not true for everyone.
Right.
Some patients don't care. Some patients do care about this. So I think it's just a question of being open and communicating with patients and getting them to start talking and then listening to what they have to say. I think once you open up the door, you can figure out for a patient what they need. But you just got to open up the door for them to talk.
I agree. And there's, like you said before, it is a topic that not everyone is overly comfortable talking about. And so, in your role, I think the more that you are addressing it and, giving patients the opportunity to ask you questions is going to speak volumes and give them, more of a quality of life in that instance. Another thing that I wanted to kind of bring up is, again, we've talked about infection prevention and we've talked about, being continent, staying dry. Ultimately, what does success look like?
Well, it's those three categories that I started off saying before, right?
Mhm.
So I see successes, and those three categories are independent of each other. I can have patients who are perfectly happy with their quality of life, but their kidney function isn't doing too great. And
Right.
so I get patients whose kidney function is okay and their quality of life is okay, but they keep having hospitalized urinary tract infections. So to me, success is those three categories, right? So you're not getting recurrent urinary tract infections that are however we define urinary tract infections. It's a whole nother conversation. Their kidneys are safe and they are happy,
Mhm.
whatever that means to them,
Mhm.
right? And there's no answer to that one. Quality of life is really individualized,
It
right?
is.
So it's them telling me I'm good. I can live like this and I'm happy. Okay. Or at least with regard to what I can do.
Yeah. And when it comes to, these long-term outcomes and how success must be completely individualized, what are some ways that you encourage folks to advocate for themselves and for their health when it comes to bladder management?
Mostly is talking to patients and getting in to see the right person,
Mhm.
right? I mean, a lot of my patients are coming to see me after they've gone to see multiple places. They haven't gotten care with a urologist. So I think part of it's advocating just to talk to people and get referred to
Right?
someone who can help them, and to advocate for themselves, to at least to get in the door for the right care. I mean, that's the start of it, really.
Mhm.
Um, the other thing that I do try to remind patients and doctors in general is that it's a moving target a lot of the time.
It is.
So we might be fine for a few years with a patient, but then things change. Life changes, their bodies change, their disease might change,
Mhm.
especially if we're talking about things like transverse myelitis or MS or things that are
Right.
sort of evolving disease states. And so it's important to sort of stay with them and maintain a relationship so that they feel comfortable speaking up if things have changed.
Absolutely. If you had any words of wisdom or tips and tricks for any of our friends that are listening to this podcast right now, what would that be?
Words of wisdom or tips and tricks. That's a
Mhm.
harder
I know.
one. Tips and tricks is really, it depends on the patient, really. I mean,
Mhm.
that's usually technical stuff, right?
Right.
What I do tell people, especially when it comes to cathing themselves, is that there's a bazillion types of catheters out there. There's a bazillion options. There's lots of things we can do so that if they can really work on identifying if they're having a challenge of figuring out what it is that's challenging for them,
Mhm.
um, there are things we can do about that. And that
Absolutely.
might be physical position, that might be, their hand mobility, their
Mhm.
eyesight, their
Right.
body shape,
Mhm.
social stuff, right? I've had patients who work in places where they can't get to a bathroom or
Exactly.
can't get out of their chair or things of
Mhm.
that sort. So there are solutions that we can come up with, but it really is individualized for
It
patients
is.
in that. Words of wisdom, I don't have any words of wisdom.
I know. The world is the oyster, right? What about any adaptive equipment? Is there anything that you found to be successful for individuals, such as whether it's a pant holder or a positioning device or a catheter insert or anything that you
I
found to be
found that
successful?
patients come up with the most interesting adaptive
They do.
behaviors and things like that. That's what I find more interesting than anything else. I think some of the most interesting things I've seen are these contraptions that my patients have come up with.
Yes.
If there's any doctors listening, it's more of a question of asking your patients what works for them and then sort of
True.
rolling with that.
Hmm.
That to me is more interesting
Yeah.
because I've had patients who come up with all sorts of interesting things. Haven't seen too many off the market. There'd be some things that would be nice if people could create,
Hmm.
mostly for patients who have hand mobility
Hmm.
and their ability to cath themselves. 'Cause I have some patients who are really motivated to cath themselves, but just don't have high cervical injuries where they just don't have the hand mobility,
Hmm.
and they're kind of stuck to some regards. And we find other solutions, but they're not always perfect.
Right.
But
It's always trial and error.
yeah,
It's it's going to come down to the positioning, the equipment, the type of products that they're using,
help
their
they have.
goal, exactly, caregiver support,
Yeah.
all of that. It's so dynamic.
Yeah.
And that's one thing that I've always said is, bladder management is so dynamic. It's not one size fits all. There are so many different parts and pieces and steps and things that we can do
Sure.
to promote that independence.
You asked me about words of wisdom going back a second to patients.
Yes.
I also tell patients to have patience,
Yes.
right? And that's another thing. A lot of patients come to me frustrated, annoyed, and I tell them, we can get you better. It might take a little time. It might be
Absolutely.
stepwise. We might need to do some trial and error. We
Mhm.
might need to do some testing, things like that. It can eventually get you there, but it might take a little time. And sometimes just getting people to understand that it
Right.
might take a little while.
There's not a recipe book. Every
Right.
person is so different.
Absolutely.
Trial and error, troubleshooting, and problem solving.
Yeah.
So I know you've done a lot of research in this realm as well. Is there anything that you are currently working on that you would like to share with us?
Not that I'm currently working on, although some of the interesting things I've seen is the use of probiotics and various, bladder installations of that sort.
Mhm.
Those are the things I think are most interesting coming out, but
Mhm.
TBD on what
I
works
like
and
it.
what doesn't.
Yeah.
But there's some work on the use of probiotics, avoidance of antibiotics. I think that's probably the biggest push right now on the
Mhm.
research world. I think part of the things that's hurt my patients the most is just overuse of antibiotics.
Yes.
And I think if we can curb that, we'll do
Mhm.
some better work for patients.
I think you're completely right. Normally, we're just, so quick to give someone an antibiotic and
Right.
say, good luck. But I mean, that's going to kill off a lot of good bacteria as well. It messes with the gut.
Right.
There's just so many.
We see just a lot of
issues.
trouble with overuse of
Right.
antibiotics. And that I think now there's a lot of work. There's a lot of recognition of that and a lot of research trying to figure out how to avoid that.
Mhm. Well, as we are gearing up to wrap up this podcast, do you have any closing thoughts that you would like to share with our listeners?
Well, I'll harp a little more on the sexual function
Please do.
factor of that, because I think that's one of the things that I think people are most hesitant to talk about.
Mhm.
Even patients are sort of hesitant to talk about
They
it.
are.
And I think patients need to be open about it. Doctors need to be open about it,
Mhm.
especially in our young patients. Well, I shouldn't say that. My older patients also need to talk about it. But a lot of people think, oh, I have this disease, I have this condition, that's it. I'm not going to be able to be sexually intimate with anyone or be, and that's just not true. And there's a lot of solutions that we can come up with, and there's a lot of things that we can do for people to get them back to living their
Mhm.
lives the way they want to live their lives.
Are there any resources that you would recommend to folks?
Mm.
I always go towards the Pleasure Able guide. I'm not sure if you're
Okay.
familiar. It is great. It's
Okay.
called Pleasure Able. It's geared towards individuals that have disabilities, and it is everything from positioning, equipment. It is
Good. I'll have to look
fantastic.
into that one.
Yes.
Okay,
What about
good.
any resources that
I
any
don't have any
books?
books or anything. I just end up talking to patients about it, but now you've given me an idea. So now I still have to go look
I
at
will
some.
give you some resources. Absolutely. It's something I'm very passionate about.
Good.
So it's a project down the road for
I
sure.
find as soon as I open up the door and just start talking to patients about it,
Conversation.
yeah, they open up about things.
Yeah.
Some of it's
Agreed.
just educational,
Agreed.
little things like telling people to cath before they have sex.
Yes.
They don't leak,
Yes.
or things of that sort, which is sort of simple solutions, but
But so many times they're just not
Right.
aware of it. They don't
Right.
even realize that it's an option.
or just say that this is something that you can try.
Mhm.
Sometimes it's important to have the partner there. It's a delicate balance because sometimes people
Right.
don't want to open up when their partner's there. Sometimes they do.
Mhm.
But sometimes it's nice for the partner to hear this too,
Mhm.
which is another thing that's important.
And that's key is they have to have that open communication and they have to be prepared for, any potential barriers that might arise. And I think it's a crucial piece. Absolutely.
Yeah.
Well, I am so thrilled that you were able to chat with us today. I greatly appreciate your time, and it was so much fun to chat with you. And friends, I just want to encourage you, check out the Ally Program podcast wherever you listen, like, follow, subscribe, and check us out on Instagram. And we look forward to having you all back in the future listening to more episodes. Have a great day.